My name's Christopher Lull, and I'm a business and technology consultant. Since 2003, I've been helping hospitals to implement Epic systems for professional and hospital billing. If you're not familiar with Epic, it's become the dominant electronic health record, or EHR, in the United States, especially among academic medical centers. At its core, Epic is for clinical charting and electronic health records keeping, but it's also operating software for the business of running a hospital, including hospital and professional billing. For large academic medical centers, these billing systems generate billions of dollars a year in cash receivables. For the last decade, I've been employed for a large academic medical center on the West Coast. My initial task was to lead the team that implemented Epic's hospital billing. My work for the last few years has focused on looking for ways to enhance and improve our revenue cycle performance and patient satisfaction with billing in our organization, and to design projects and initiatives that take advantage of those opportunities. And that's the backdrop for this talk today. Maybe you're part of a large organization who has a lot of complex software, but you're finding you still have a lot of paper documents coming into the organization, and there's a lot of internal paper that also needs to be indexed. I'm going to talk today about what we call the Ricoh Intelligent Capture Business Correspondence Solution. It's a system designed to scan, store, and automatically categorize and index documents. When we set out to begin this project, our challenge was that we were looking at almost 300,000 pieces of mail a year coming into our organization. And at the time when we started, we were processing most of that mail physically to begin with. Some of it came through the lockbox, but in large part, we were opening each envelope, removing any blanks, sorting the documents, and then sending it back to the lockbox for scanning. We had a backlog of about 2 weeks. So when a piece of mail came in, it sat in a stack of mail waiting to get sorted. First in, first out, but we were still took us about 2 weeks to reach each piece of mail. And that delay could be in an account that was under audit. It could be a notification of a denial on a claim. It could be a bankruptcy notification where we're under a time crunch to stop communication with the patient, etc. So we were looking to try to reduce that backlog, and we were looking at a way to reduce the amount of labor it took to process all of this incoming mail. The other thing we were looking for was to make sure that we had a good system for tracking and reporting for compliance purposes all of the incoming mail as well, so that anything that came into our office wasn't missed, but properly indexed and to the right account within Epic systems. All this effort took between 11 and 13 people, depending on the day. Let's say 12 is the happy medium there. 12 folks working on this every day just to process the mail coming into our billing offices. When we started this project, our solution initially, prior to the Ricoh Intelligent Capture project, was to take and scan the mail, and once scanned, have that in a system, and then go into Epic and manually create what we call a correspondence or BDC record in Epic systems. You can imagine our staff would have 2 screens. On one screen, we would have the scanned document, and on the other screen, we'd have Epic open. Looking at the scanned document, the staff would go through and they'd first try to figure out what sort of document they were looking at. Was this a refund request, or a denial, or an approved authorization? Etc. Was it patient correspondence? Was it a notification from the insurance company? Once they figured out what sort of document they were looking at, the next task was to go through the document and figure out who it belonged to. And the staff would manually read the document and scan for patient identifiers, such as the guarantor ID, a hospital account ID, professional invoice, or perhaps subscriber ID. If we didn't have one of those discrete identifiers, we were left searching by patient name, and occasionally we'd have just patient name and date of birth. The staff would then search Epic for that patient. Once they found the patient, they'd open that patient's account, and then they would manually create a correspondence entry. Once that correspondence entry was created, by entering what type of correspondence it was, the staff would then go back to the scanned document, and using a document ID that Epic had generated in the process, they would rename the image file to the document ID, that numeric string .pdf. We'd then place that document in a share folder, if you can imagine, and then Epic would know to go look for that particular file name. It was a rather complicated process. It worked pretty well for us. We had a way to index documents to Epic and make those documents viewable without a third-party document solution in the middle. In other words, Epic's native PDF viewer was able to reach that document and open the document. So it was elegant from a viewing perspective, but the amount of work to get that indexed into Epic in the first place was really the backbreaker. We knew also that we were growing as an organization from a series of hospitals and clinics into a much more regional health network. And we were bringing in different partners, different physician groups, some of whom had their own billing agencies. So we were looking for a standard solution that we could offer across our different practices and across different customer service organizations, and that would be able to handle increasing volume of mail that growth entailed. We started looking around at how we were going to try to better automate this solution. We started looking at Ricoh mostly because Ricoh had worked with us in the past on some document solutions, and there was a history of success there with Ricoh. That team, the Ricoh team, front to back, really understood our client needs. They understood the underlying business of professional and hospital billing, and then how the documents that were coming in were really related to the underlying business. We also saw with Ricoh an innovative approach to problem solving that we share within our academic medical center that fosters the idea of working collaboratively rather than giving us something out of the box. The folks at Ricoh came in, listened to our business requirements and opportunities, and then helped us find a solution that would fit. Not just to find a solution, but really tailor a brand new solution, which is what we were looking for. We didn't see something in the industry that we could just plug and play in this case. We needed a solution that would take into account the complexities of the underlying business and the documents we were looking at. So when we started this process, Ricoh put together a team, and they came in and we met for 3 days in our billing office here on the West Coast. And we sat in a conference room, and we started talking about the documents that came in through the mail process. And what we looked at when we started is that on one side, for the physician billing side, we had maybe 45 different document categories. And then on the hospital billing side, there was maybe another 35. And for some of our more ancillary practices, there might be a whole different set of document categories that part of the business had developed based on their business needs. What Ricoh helped us do was look at the underlying structure of the documents to try to consolidate our document categories. And we were able to go from a few hundred down to a really elegant 22 or 23, maybe there's 24 at this point, but essentially around 20 document types that really encompassed every variety of document at its core. Bankruptcy notifications, as I mentioned before, refund requests, denials at the claim level, approved authorizations, patient correspondence, insurance correspondence that didn't fit into another category but was mostly informational, our documents from risk management. I won't go through all of the document categories, but you get the idea. We tried to reduce the set down to the core set of documents that we needed to identify. And the importance of that document identification was not so much for the development of the Ricoh software, it was to understand that once we had this type of document and we put it into Epic systems, where we wanted that document to go. Did it need to go to a customer service work queue for follow-up? Did it need to go to our billing staff? Did it need to go to the claim staff for review? In order to properly route a document to where it needed to go, we needed to not only know which patient it belonged to, but which document category it fit into, and then also design a set of rules so that when an account had a particular documentation type on it, we knew where that account would be routed and whether we needed follow-up from the staff. And so those early decisions let us start working in parallel with our Epic team while Ricoh was still doing development. We knew the document types that were coming in, and we were able to then go build work queue rules in Epic, anticipating that new document structure, so that once we turned on Ricoh scanning solution, we had the ability to route from day one each one of those documents exactly to the right staff for follow-up within our organization. So Ricoh's unique value proposition was that they could help us understand this document universe, break it down into the component parts, and then look at what the opportunities were for automating that. As I mentioned at the outset of this, we were doing a lot of manual looking at, even though the documents were scanned, our staff was still having to read those and then go to Epic and do a lot of lookup to find out that we'd gotten the right patient, etc. And then manually create that correspondence entry. So Ricoh's value proposition here was that we could reduce the amount of manual labor by reading the documents as they came in. Having the computer read the documents as they came in, and having the software analyze the document types, those 22 categories or so that we talked about, where the software would understand what type of document it was looking at. Once we understood what type of document we were looking at, Ricoh's software combined with Episoft, a vendor they chose for some of the document identification characteristics that Episoft is very strong in. We'd scan the document for patient identifiers. We'd look for patient first and last name, obviously. We'd look for subscriber ID, for guarantor ID, for HARs or invoices, etc. Patient date of birth, other aspects. And over time, what we came to realize was that we had a core set of identifiers, hospital account, invoice, and guarantor, that really were our prime identifiers, which we could use to link directly to a patient. When we didn't have one of those prime identifiers available, Ricoh was able to help us build a database of all of our patient data, so that when we had one or two components, say patient last name and date of birth, or patient last name and date of service, we were able to narrow that down to a unique set of possibilities, meaning that our staff wasn't having to fish through the entire universe of Epic patients, but had 2 or 3 possibilities, the best as far as we could narrow down. The better news than that is most of the time, Ricoh and Episoft were able to identify the document type, pull the identifiers, and then look that up in a database to identify positively which patient, invoice, or guarantor the document belonged to, and then create an import file into Epic. So we've moved from having a system with 2 screens and lots of scanned documents and staff doing the indexing manually on 2 computer screens to a system where mail comes into the organization, it's scanned, it's categorized, it's mined for identifying information. That identifying information is then verified within the database. And then ultimately, we built an import file where the incoming document, the first time that a human is viewing this document, it's already in the proper work queue in Epic for follow-up. So say a bankruptcy notification would route to the self-pay billing office folks responsible for putting a hold on all of the underlying accounts that belong to that patient at the guarantor level. So that ability to see a document coming in, to scan it automatically, to build the index, and to get it in Epic, and to route it for appropriate follow-up was the end-to-end solution that Ricoh helped us design here. The brilliance of the solution is that where we had 11 people processing documents in the past, we've been able to reduce the amount of full-time labor involved in processing our documents from 11 folks down to about 5. It varies a little bit depending on the season, and we do have times where there's spikes where we can bring a few more people in. But for the most part, 5 folks are now able to handle all of this work in managing all of the incoming mail, indexing it, and getting it to Epic, where it took us 11 folks in the past. The other thing I'd say here that's really important, is just important for our ROI, is we've eliminated the backlog. We're now able to process all of the mail as soon as it comes in. We've also been a victim of our own success in that our staff often is so efficient and so much of this is automatically indexed that we have days where the staff has run out of mail work to do. So we've been able to redirect some of those employees that we have working on this to other tasks during the day to follow up on billing records, etc. So we've seen an excellent decrease in the amount of labor required to process all these documents, and the reduction in that backlog has meant that we're able to act faster on mail notifications as they come into the organization. As you can imagine, if we had a denial for a visit authorization from insurance, in which we understood that the patient's insurance carrier was saying that the upcoming visit wouldn't be covered because it didn't meet medical necessity or some other criteria. We would have time then to get to that document and follow up with the patient and let them know about the decision about their insurance company so that the patient can make an informed decision. On the denial side, if we had a paper denial that came into our organization or a request for more information from a payer that we didn't have regular ANSI connection, ANSI status messages from, we would then be able to act quicker on that request for information or that denial, reducing the amount of time that our accounts receivable stayed active and unpaid. So the game, is everyone in the billing office, the game obviously in a billing office is to try to reduce the amount of time it takes to get reimbursed. By quickly processing the mail, we're able to focus much more on the business of getting paid rather than the business of sorting mail. So I want to talk a little bit, although I'm going backwards a little bit, I want to talk a little bit about the component solutions here. So we, as many hospitals do, we scan documents first at the lockbox as they come. We also have an abundance of surface mail that comes into different PO boxes and locations, and we also have internal mail. All of those document input categories come through and initially come through and are loaded into batches, which we then put into Episoft. Episoft's our solution for initially categorizing the documents, as I mentioned, and the solution for harvesting the data. We've been very lucky with Ricoh and Episoft to have had some excellent training for our own staff. Rather than having to reach out to Ricoh or Episoft when there's a new document type or a variation or something that we haven't seen before that we're having trouble automatically processing because of a variation we haven't seen, we're able to do a lot of that programming ourselves today. So we're not reliant on the vendors for help handle new document types. So the other thing I want to talk about is after the document's scanned in Episoft, it then moves to the Ricoh ED. The Ricoh ED is really the brains of the outfit, where Episoft is doing the OCR identification and categorization. Ricoh on the back end is taking all of that data and matching it against our Epic data set. And it's giving us positive patient, guarantor, or invoice identification. And better than that, Ricoh's got a set of rules that understands that, I've used this document category too often, but bankruptcy notification, for example, applies not to one single account within that belongs to a patient, but all of the accounts. So when we have something like a bankruptcy notification, we know that applies generally to all of the patient's accounts, whereas a refund request from an insurance company is probably linked to a specific account and even a specific invoice. So Ricoh's business intelligence rules on the document help us make sure that we link to the right level within Epic, that we've got the right patient. We have a very, very low error rate. We only see a few errors a month, if that. Since the advent of the project, I'm only aware of just a few times where we've wound up indexing the wrong document to the wrong patient. We obviously have tools for quickly correcting that, but it's really been a non-issue. So I think I talked a little bit about the lockbox, about Episoft, about Ricoh. The best part of this, of course, is that like most large academic medical centers that have made a multi-hundred-million-dollar investment in our EHR, in Epic systems, we're really able to use this solution to effectively get the documents into Epic using our enterprise document repository. And then that means that we don't have to have any additional software. So for the folks that are processing these documents and working on them, these documents are right there in the system in Epic. There's no special software to remember. There's nothing to learn. There's no login, separate login to have to remember. All of this software that we have for indexing is particularly elegant because what it means for the end user, that is the person viewing and acting on the document in Epic is they don't need to know that Episoft and Ricoh was a part of the mix. They've just got the document in Epic right in front of them, integrated into their hyperspace for account follow-up. So I've talked a lot about different things here. One of the things I want to call out in particular is just how great a job Ricoh did in helping us design this solution. As I mentioned, we have the scanning of the lockbox, we have the Episoft piece, and then we have the Ricoh piece. Ricoh's solution was not just limited to how their software interacted with the other pieces, Epic and the pieces I mentioned before, but really looked holistically at our document use across the organization and how we could leverage these tools and integrate them together. So when we have an issue, we're looking to Ricoh to help quarterback and lead the solution across the different vendors and technology pieces. It's easy to look at this as a mail problem, but if we think about those 300,000 pieces of mail coming into our large academic medical center here on the West Coast, and what we need to do to act on them, each one of these documents is a call for some action. It could be as simple as sending a set of medical records to accompany a claim. It could be as complex as an audit from a payer or from a government entity. It could be a threat of legal action based on billing practices. These are incredibly important documents for us to process and to get in the right place in Epic. And Ricoh helped us build an end-to-end solution that helps us do that effectively today, in less time, with less people, and with more automation than ever before. I encourage you to reach out to Ricoh to see how they can help with your document solution going forward. One of the great things about Ricoh, as I mentioned, in addition to the reduction in labor and helping us solve the backlog of documents, is we really now have excess capacity to process documents. Because the scanning solution is so effective in its automation, we've been able to extend the solution not just to our core business offices, but as we build in new partners. We had a hospital across the bay join us recently within our instance of Epic. We were able to offer the scanning solution to them right out of the box. As soon as they came online, we've been able to start processing their documents. We've also been able to extend it to some of our physician partner practices that are spread out in the areas surrounding our metropolitan region. And we've been able to give them the same solution that works for the hospital for the doctor's office. The other thing that I want to talk about here that I didn't mention before is that one of the great unexpected things here is that we put the solution in place right before the dawn of the COVID crisis in the United States. And so you can imagine, as I mentioned, with all of the paper sorting that we talked about, that how dependent we are on folks being in the office to open envelopes, to scan, to sort, to put the batches in, to just move paper around, getting it ready for its journey from a paper document to an electronic image. Because one of the great things about having the solution in place is that we've been able to have a very small footprint of folks who need to be in the office. Sometimes as few as one person a day can be in the office to help us with all of these processes. So we've enabled a remote workforce by being able to quickly move to automated transition between paper documents and electronic images that we can automatically index and process. I want to mention too here the Ricoh All-Star team. Ricoh brought some of the most talented folks in the industry in terms of understanding the underlying business needs of our academic medical center, how the paper documents were important to us in terms of the actions we needed to take. I'll mention a particular client executive who came to the table full of new ideas about what we might do to improve this process and helped us really build the team that would help implement the solution. We also had an incredibly dedicated solution expert and sales engineer who helped us not just understand the requirements, but move from a set of ideas on a whiteboard all the way through implementation to help us dial in the performance of the system as we came up for the first few weeks, and then ultimately who held the hand of our staff to get them trained so that we were proficient in this without the help of the vendors. Clearly, they've retained expertise that we'll turn to, but we're largely self-sufficient when it comes to programming on these platforms. And for that, I'm very grateful. And then last but not least, I'll mention the Ricoh solution architect. He came into our organization and really helped us fit these pieces together. We have Epic, our EHR, and because we've invested so much money in there, the ultimate goal was to really make things work as seamlessly and effortlessly as possible with Epic. We had Ricoh, which is really the brains of the outfit. And then Ricoh helped us figure out the right component to put in the middle there, which in this case happened to be Episoft for that document processing. Ricoh's expertise in fitting these pieces together to making sure the cogs were interlocked and turning tightly together has been invaluable to us. We've processed over 150,000 documents so far. As I mentioned, the error rate is exceptionally low. We are doing less and less exception processing as we go forward, as we identify areas of documents that weren't automatically categorized and indexed. Ricoh's helped us take those and then learn from those documents and help program the system to make it forward. So that was a lot to talk about documents, but I was happy to share our experience with Ricoh here. I don't think we could have asked for a better team to help us implement the solution, and we've already seen very positive ROI benefits, many of which we'll enjoy for years to come. This is a solution that's going to work really for every hospital in America, and it's game changing in a number of ways.